Now I'd like to invite on stage Congressman Gene Green. He's the ranking member on the House Energy and Commerce Subcommittee on Health. We're looking forward to hearing from him this morning about the role of Congress in ensuring that changes in the healthcare landscape are focused on creating value for patients. Welcome, Congressman Green.
Thank you.
Thank you very much. I don't know if you had a chance to hear some of what the senator was saying, but you certainly are familiar with the discussion. So let me start you off kind of where we left off with Senator Cassidy, and that is he has a kind of a, on the one hand, on the other hand, assessment of where mergers and acquisitions in the healthcare industry and the private sector may be leading us. So let me start there with you and ask you, are we seeing this trend because of government involvement in healthcare or in spite of it?
I think it's in spite of it. Now, the only hearing we had on the House side was Judiciary had a mergers and acquisitions in February, but our Health Subcommittee hadn't been approaching it, but we haven't had any hearings. But obviously there's some interest in it, particularly when you have Berkshire Hathaway, Amazon, and J.P. Morgan Chase that could probably form a pretty good sized insurance company. Although so many of the large companies already are self-insured. They just partner with an insurance carrier to provide it. So, but it hadn't been focused on, at least in the House, except Judiciary.
Do you see that as an innovation, a real innovation, or is it a little early to know?
I think it's early, but I think the horizontal would be more of a problem, and that's what we're seeing. Although we all lost a hospital in Houston because of the flooding, and they had been flooded for many years, but the mergers from hospitals and from insurance companies together is probably much more problematic than it is the lateral.
As a Democrat, when you are assessing the landscape of these mergers and acquisitions, what are the indices that you're looking for? What concerns you? You mentioned one, losing a hospital. What's your base value that you start with when you're assessing this trend?
Well, what I'd like to see if it a more expansive coverage of folks. In our country, we decided back during and after World War II we were going to have employer-based, and even with the Affordable Care Act, employer-based insurance covers more people than the ACA ever would. And to see how we can expand that to have more people covered, whether it's from Amazon, from somebody working on their warehouse floor up to the highest employees, to see that they have quality insurance for their families. And again, Berkshire Hathaway that owns tons of companies that to make sure they could expand the coverage for health care instead of restrict it.
So you were talking about, are more people covered? Are more people getting health care? How do you fit into the idea that some assessments are that this trend that we're seeing is driven by costs and competitiveness, as opposed to the concept of, can we cover more people? Are we offering more quality care? Is all of that built in, or are you concerned that some of that will be missing?
Well, again, the private sector can do that, but I think to pass the smell test on, you need to show some things that are actually much better, other than just saving money, more efficient delivery of health care. And that's a lot of our goals, though, have more access. And if we can do it for the private sector, that's great, just so we get it done. And that's something I'd be looking at. Again, the horizontal mergers between, an insurance company and CVS or something like that may not be the problem that if we had, Cigna and another company merging together. And so that would where you'd look at some antitrust issues.
With your long experience in Congress, listening to healthcare debates over how many years? Lots.
26 years.
Yeah, 26 years, 2 decades, more than 2 decades. What's the role of Congress in watching this private sector trend, and which is going to be increasing this year? What's the role for Congress?
Well, I think on a bipartisan basis, because the senator actually served on our committee before he was elected, and coming from Louisiana, he doesn't make fun of my Texas accent, and I don't make fun of his. But I think he and I worked together when we were in the House, and some of the things he does in the Senate, I think is a problem solver, and that's what we're looking for. Whereas depends on the leadership of the House how what issues you focus on. Of course, anybody watching a health subcommittee knows the last month or 6 weeks or so, we've been immersed in opioid addiction legislation that we finally passed most of it out. I think there may be a couple of bills left last week, so that hadn't been on our radar screen.
All right. One of the things that folks are talking about is maybe the employer-based insurance healthcare coverage system is ebbing away. Do you believe that's true?
Well, I've heard that for a long time, and we did have, 25 years ago, our employer-based insurance was fine because most employers covered their employees. But about 25 years ago, employers realized, particularly smaller employers, that they didn't have to cover their employees. And so we ended up with such huge numbers of uninsured showing up in our emergency rooms without any kind of coverage at all. And that's what brought about expansion of the Affordable Care Act. We tried to build on the employer-based insurance. And like I said, today we still have more people being covered by their employer health care than will ever be part of the ACA, and trying to add coverage to people who didn't have it through their employer. And the requirement that if you have 50 or more employees, individual mandate that, of course, this administration is not helping things. So.
Do you buy into the idea that the Affordable Care Act is partly a catalyst for this private sector trend that we're seeing?
I think you can't take anything out of it when you make a business decision, particularly on the level of a J.P. Morgan or Berkshire Hathaway. They might have not have done this if we didn't put together, have the Affordable Care Act. And the problem with the Affordable Care Act is because of the controversy over the last 8 years that you can't fix it. We've gone all these years, and if we had created Medicare in 1965 and not over the period of time since then adapted it, it would have been in trouble too. So we haven't been able to do anything except keep it on the books, but it's been chipped away at. And so we're going to see more uninsured because of the lack of the ACA. And I think these companies are looking at it because ultimately, if you're a company that has insurance for your employees, the uninsured, you're going to pay for it. Somebody's paying for it. And that's why everybody has skin in the game. Everybody ought to have some type of health instrument. And of course, in Texas, we didn't expand Medicaid. In our district, 46,000 of my constituents in Houston would have received Medicaid if the state would have taken the 90% reimbursement of it. So sometimes politics gets in the way of good policy.
Ah, shocking.
Shocking.
Shocking. Let me ask you, because of your long experience, you've watched 2 Democratic presidents, now 2 Republican presidents, many Congresses wrestle with health care. You have a daughter and a son, or son-in-law, who are physicians working in the business, in the industry, in healthcare. And we're listening to Democrats politically debating about where we should go forward, right, in the next iteration of this political debate. Do you have any advice for the Democrats who are seeking to win seats or maybe thinking about 2020 about where you see this debate going? They seem to be thinking it's some of them single payer or government based, not private sector as the answer. What do you think?
Well, obviously at the Democratic rallies, Medicare for all or single payer is the popular thing. But when you come into Congress, we have to find something that has 218 votes and can get through the Senate. And our problem with not being able to fix the Senate, and you may remember that Senator Kennedy passed away and the Senate lost our votes over there, so we couldn't have something that the Senate would do. So that's what, for the last eight years, all we've heard is repeal and replace. Obviously, that hadn't worked out very well either.
So your advice to Democratic candidates is what?
I think they need to be reasonable and say, sure, ultimately, and I use this argument, all our industrial competitors that are democracies, Western Europe, Korea, Japan, have some type of national health care. And we created them after World War II. And yet we still stuck with the employer-based that began in World War II and afterwards. And like I said, for decades it was fine until employers decided that wasn't their responsibility. And if we want to make employer-based insurance work, free market, then we need to make sure it's effective. And employers need to cover their, with a quality insurance plan. We're seeing some, what the administration's trying to do with these slim down plans, but having served before Congress 20 years in the legislature, and I watched us trying to come up with a plan in the state with that, and you end up, if you don't pay the money, you don't get the quality. You know, it wouldn't cover maternity, it wouldn't cover emergency rooms. I had a constituent who worked for a large retail operation, and when before the Affordable Care Act, and she found out she had a terrible illness, and it was going to cost $250,000. That insurance policy was only paying $20,000. So we don't want to go back to those days.
We have time for maybe one question or maybe two. Let's see. Anybody wanted to ask the congressman a question? Hands up. Anybody? Let's hear from this young lady here. Who are you with?
Good morning, Congressman. I'm actually with 3M.
Okay.
So welcome. Thanks for being here.
Thank you for the use of the hall.
You know, I'd be remiss, I know we're talking a lot about mergers and innovation, but I'm sure you're aware one of our biggest priorities in healthcare is the repealing of the medical device tax. We've heard from Leader McCarthy that they may actually bring this to a vote in July, Mr. Paulson's bill. And I'm wondering your thoughts on that. You know, we cannot not talk about it with discussion of innovation. The medical device tax really hurts companies when they're innovating. It hurts jobs. It hurts research. 3M obviously felt those consequences when the device tax was in place. So I'd be interested to hear your thoughts on that.
Well, if you're talking about the medical device tax, that wasn't a House proposal. It was part of what the Senate sent us in the Affordable Care Act. In the House, we voted that down in our committee, and we're not to help pay for the Affordable Care Act with the device tax. We had it paid for different ways. My worry about that is I don't want to stifle innovation. I want to make sure whether it's a new formulary that can help somebody with diabetes or a cure to cancer or anything else. I don't want to put a disincentive there that we wouldn't do it. Although the incentives may be in Europe or Asia, I would rather that incentive be here in the United States with our researchers.
Great. We have time for one more. Let's see. Maybe wait for the microphone, this gentleman here.
Yes, good morning, Congressman. Dr. Richard Hartman, Chief Strategist for the Air Force Surgeon General. It was interesting that you brought up the issue about Berkshire Hathaway, JP Morgan, and Amazon. That's not a merger acquisition, that's more of a collaborative.
Yeah.
But what I think this is more of a comment and something probably for you to think about when you go back to your committees, is that they're focused on the employees. So when they focus on the employees, that's not where necessarily their costs are. So if you look at their strategies and how they're developing it, what they miss is what you discussed was the beneficiaries, which I found was unique, because you're saying that, but when you look and see where they're going, where their strategies are not that. But I think there are people within government, such as the Department of Defense, that you can look at to see how we're doing things that focus on both beneficiaries as well as the high-performing, individual that we want to take care of, to enrich that, what I call consumer. They're not patients until they get sick. They're consumers, and that provide a relationship.
Okay, let's leave time for the congressman's comment.
That's correct. I would hope that's what would the collaborations, but that's available now with self-insurance, I think. They could probably, if those three entities wanted to come together, and they can literally write their own policy if they want to do. But again, it doesn't do any good for a company to cover the employee without covering the children and the family. And again, maternity, lots of things. My son, who now is managing a company, when he was 10 years old, he liked to skateboard on curbs. And so we had a broken wrist. We had all sorts of problems. But I was fortunate enough to be at a company that, at that time, because I was in the legislature, that actually had insurance for our, it was a bargaining unit, though. We had insurance through there for our beneficiaries.
Great. Thank you. We promised to
Thank
let you
you.
go on time.
Okay.
And thank you very much.